The Honourable Member for Halifax Citadel, Sable Island.
Thank you, Mr. Speaker. I am rising on behalf of my caucus to speak to this proposed bill. And I know that this is a bill that can be difficult to discuss, particularly for individuals and families whose lives have been impacted by it. The need for involuntary psychiatric treatment tears people, families, and lives apart. It is not simply when someone is living with a mental health issue, but it is truly when folks are in a mental health crisis. And in those moments, it's difficult to see the way forward, no matter whether you are the patient or the caregiver. And it comes at the end of a long cycle of need for treatment, of healthcare crises, of failures of systems, multiple systems, and everyone involved carries trauma and is exhausted in those moments. And so I agree with the honourable member who spoke before me in terms of the need to really take care when we are dealing with the most vulnerable as government, when we take on this role of caregiving, when we apply this act. We need to make sure that we do have the best standards that are monitored, that are reviewed, and that put patients first. And in particular, just to note that a lot of times folks who have been through successive multiple mental health crises struggle with other social determinants of health and actually may not have a support system. So it is them often on their own and very likely don't have access to an advocate outside. Some of the amendments so far look good. I'm looking forward to hearing from folks at Law Amendments, but certainly, it's all in the implementation. So when it talks about emphasizing that decisions must be based on evidence, well, actually, the evidence around mental health and psychiatric treatment is actually always evolving. So how are we going to make sure in implementing this act that that the people making decisions are connected to that, and that there's an agreement on what constitutes evidence. That people must be treated with cultural safety, and again, that's very important, but also really calls for the need to involve communities and people and families with lived experience be part of understanding what cultural safety looks like in the context of severe mental health crises and involuntary treatment. I note that it also will update the definition of capacity. It will require facilities to provide information about the patient's rights and how they may exercise them. And on that, I guess I would also recall the comments of the previous member around what that actually looks like. Again, it's around the implementation. So how do you communicate with folks who may need access to this type of treatment? I wrote down the word communications, but it's also like knowledge mobilization, right? So that people have access in language that meets them where they're at, in ways that are accessible to understand what their rights are. We also need to ensure that folks are trained and are aware of the standards that this act, the changes in this bill will set. So it's all well and good to pass this act, but if people on the ground who are the people who are working with folks in mental health crises, and that in itself is a very difficult role, they also need to understand what the patient's rights are and what's changed and what they can offer or provide. So I look forward to further discussions of this bill at Law Amendments, and thank you for bringing this forward.